Good day and welcome to the StayWell Fueling the Fire Insights from a System-Wide Fire Implementation Conference Call. This call is being recorded. At this time, I would like to turn the conference over to Mr. Joe Qualtier, Senior Vice President, Sales and Commercial Operations at StayWell. Please go ahead, sir.
Well, good day, everybody, and thank you for joining our webinar today. We're very excited for our Fueling the Fire webinar, Insights from a System-Wide Fire Implementation. Over 5 years ago, FHIR was first proposed by Health Level 7 International, laying the groundwork for electronic health record systems to speak with third-party applications using a common language or API. Smart on FHIR was born shortly thereafter, and over the last 2 years, FHIR applications improving interoperability and accessibility of data within the EHRs have become a reality. However, very few organizations have deployed a Smart on FHIR application enterprise-wide. We've invited you to join today to hear directly from the clinical and IT leaders from Houston Methodist Health System in Houston, Texas, who have recently completed a successful system-wide implementation of the CRAMES on FHIR application. Over the next 45 minutes, they'll share why they chose to adopt CRAMES on FHIR, how they approached their system-wide implementation, which spanned their academic medical center, 7 community hospitals, and 100 clinics. And most importantly, their practical recommendations for other organizations that are planning to adopt FHIR technologies. Throughout the presentation, please submit any questions you have through the chat feature. At the end, we'll answer as many questions as time permits. For more in-depth questions, we'll be happy to set up a follow-up call. With that, let's dive in and introduce today's speakers. We are excited and thrilled to be joined by Suzanne Lee and Jennifer Collier from Houston Methodist. Suzanne and Jennifer spearheaded the deployment of CRAMES on FHIR throughout Houston Methodist and just recently celebrated the first official go-live with CRAMES on FHIR nationally, which is a huge honor. This milestone speaks volumes to the culture of innovation that resides at Houston Methodist every single day. Suzanne and Jennifer, welcome to the webinar, and thank you for joining us today. If you wouldn't mind, given the, yeah, go ahead.
I was going to say thank you, Joe. We appreciate your support, and we're happy to participate in this today.
Awesome. Well, if you wouldn't mind giving the audience a little bit of an overview and intro of the team speaking today.
So this is Jennifer Collier. I manage the ClinDoc, Stork, and ASAP resources for our Epoch implementation within IT. We currently have 17 FTEs that are devoted to inpatient documentation. We've got 5 that are specific to our ED. And so it made sense for Suzanne and I to partner with our operational leadership to look for the best technology to really start to focus on patient education.
Thank you, Jennifer. And just a little bit about myself. I am Suzanne Lee, Director here at Houston Methodist within IT. I have under me many of our clinical applications, and been at Houston Methodist for about 13 years, and a nurse in the field for 20 plus years. And this has been a very valuable project for Houston Methodist, and as we go further, we'll share some of the insights that we've learned along the journey.
Okay, well, thanks, Suzanne and Jennifer. We're really excited to hear about your experience with the implementation. And of course, I'm Joe Qualtier, SVP of Sales and Commercial Operations at StayWell. We also have a few representatives from the StayWell implementation team who partnered very closely with the Houston Methodist team, and who were on site during the Houston Methodist Go Live. So if we have any questions later, we may throw some questions over to them. All right. Suzanne, why don't you go ahead and give everyone a recap of the impressive organization that Houston Methodist is today.
So Houston Methodist is an 8-hospital system located in Houston, Texas. One of those hospitals is a teaching facility. The others are our community hospitals, and one is licensed as a long-term care facility. Houston Methodist has over 2,000 inpatient beds licensed, and we see over 103,000 inpatient admissions annually.
Okay, fantastic. Before we dive into the insights we gained during the implementation process, why don't we give the audience an overview of the Houston Methodist and StayWell relationship over the years? Suzanne or Jennifer, can you address the relationship with StayWell?
We sure can. I have to say that our greater than 10-year partnership has been a very professional relationship with a lot of trust. As an organization, we don't easily step into beta development, and we know that the impact to an organization and the dedication with your vendor has to be significant. So it was with this that we made the decision, and we haven't regretted any of that step that we took. Patient education is key to success for many of our hospitals across the nation. It helps reduce our readmission rate. We have better outcomes for our patients. So the value of that for our patient engagement is very, very high. And historically, we've used the content from Crames StayWell, whether it would be through our Crames On Demand videos, and even the integration in our Epoch system when we went live about 3.5 years ago. We wanted to go forward and make any strategic decisions for the future was that single source for our patients, and that was utilizing Epoch's tool for our patient portal, and StayWell's solution really granted a lot of those viable options for us.
Well, fantastic. Thanks for the background. I can say from the StayWell side that it's been a really true strategic partnership, and one of the early adopters. We couldn't have had a better partner to go through that process. All right. Well, FHIR continues to be a hot topic within healthcare IT. Can you give us some context on, why Houston Methodist wanted to go with this particular FHIR application and some of the value you saw to your organization?
Absolutely. We wanted to continue to position Houston Methodist as an innovator in our marketplace. Not only do we have a lot of competition here locally within the Houston market because we have one of the largest medical centers, we want to really continue to lead medicine across our nation. And this was a great solution when we dove in and really started looking at it. Our IT division really wanted to engage in something that had ease of updates. With our EHR solution, Epoch, we've moved to quarterly updates. And we wanted to reduce that, the lag time in between updates, and this solution really provides us that option. The workflow for the clinicians was another key piece that really won over our System Education Council as they did the evaluation. They wanted to be certain that our clinicians had the tools at their fingertips to provide the latest and greatest information, whether it be around medications or really around the patient's condition. So that was one of our larger reasons that we went in that direction. Around the innovation piece, providing the video solutions to the patients, for far too long, patients have been discharged with massive pieces of paper, packets, overwhelming, and research has led us to believe that video content is truly the solution that gets better engagement. So as we made those decisions, the video solution was key and top of the list. And as I mentioned before, the patient portal, providing that single solution and reinforcing that with our patients after discharge, even in an outpatient procedure area, go back and refer to that content, it would be in their MyChart, which is our solution for our patient portal. And lastly, the reporting capability. As an organization, we are a data-rich organization. We like to maintain that analytics and really watch where we are in the marketplace, whether it be from our patient satisfaction scores or some of our hospital ratings. Those are key to performance and for our strategic long-term planning.
Okay, great. Well, it sounds like there was a few themes there. The ease of updates was something that was critical for your organization. The enhanced workflow for the clinicians being native within the EMR, as well as video solutions. Can you speak a little bit more about the impact on patient care, having real-time updates to the clinical content, whether that be a med sheet, a health sheet on a standard procedure, or videos?
So previously we were doing a plan update, which took about a week's worth of an analyst time to put the updates from StayWell claims into our production environment. This current FHIR technology allows us to take real-time updates from StayWell claims, and it doesn't need the intervention of an analyst to do anything. So as the vendor is making changes and making sure that their content is the most up-to-date, we have the most up-to-date content for our patients.
And then I'll weigh in, thank you, Jennifer. I'll weigh in on the patient experience aspect. If the patient is placed on a new medication while in the hospital, with this particular application, if the nurse is dosing that first med, they can click to that tab labeled medication and provide that directly to the patient for education. So this tool is really, truly in real time. We, as an organization that does a lot of research, we need to have the latest and greatest data, the newest medications available, and that was one of the pieces that we really valued, not waiting for an update to happen.
Yeah, absolutely. It's critical. As we know, guidelines are updated regularly, constantly, more than 100 per year, just on the standard content. So let's move on to your road to go live and the overall project plan. I understand you went live on the week of March 25th. Can you tell us, high level about your implementation process and what really worked for your organization?
Sure. So what we did for implementation, so while we essentially had the FHIR product live for all 8 hospitals the very first day, on Monday at 8 o'clock, what we did is we divided our hospitals and we did a rolling support schedule so that we had ClinDoc analysts on site with StayWell, our vendor, to answer questions and really target that site and make sure that we were looking for who their adopters were and working with them as well as working with their resistors. So by the end of the week, we had gone to all 8 hospitals. We had really, really good feedback from our end users. I know I heard if you can shop on Amazon, you can use the FHIR product. I think that the intuitiveness of the graphic design and it's very, very user-friendly, that really assisted with the adoption across our system.
Okay, fantastic. I know anytime you change a clinical workflow, there's a lot of angst with that, so it's great to hear that it was very intuitive and well received. So we're going to go into some of the best practices that really were the key to the success of your implementation. And the first was engaging early with the proper governance. Can you take us through your approach to getting the right stakeholders from a leadership perspective and all the various departments that are impacted by patient education?
Absolutely. The key truly is to engage early. You've got to line up your stakeholders and make sure that there's a desire for this change. We were very fortunate to have an executive sponsor coming out of operations, one of our CNOs that just happens to be the executive chair over our System Education Council. So partnering with the right key folks, starting at the executive level, and then working your way down to really establishing, who's going to be the business owner from operations, and then who's the business owner from your IT area. And of course, there's technical aspects to this, and we had some strong technical leadership that really assisted and made sure that we have dedicated resources that can focus on this. one of the natures of a world of IT, particularly in healthcare today, is we're not doing just one singular project at a time. We're doing multiple projects and we're balancing. So there's a key to making sure you have the right engagement. So that sponsorship from your executives is key. Having the business owners in both the IT side as well as your operations side is key. And then when you come down to that clinical leadership level, each of our campuses have program directors of informatics at each campus. We really start with our engagement there first, and from there we use them to disseminate to the clinical leaders at each campus. We provide a lot of the tools for communication, a lot of the handouts. In a little bit, we'll talk a little bit about how we educated by using our LMS system. But with all of this as a foundation, your project's not going to be as successful. So we highly recommend engagement early. Don't forget the executive level, and then make sure it pushes all the way down to the end user.
And tell me how important...
Yes,
yeah, go ahead.
Application level, absolutely.
Yeah.
Well, fantastic. Well, tell me how important was it to kind of level set with the entire organization the benefits to each stakeholder and why the organization was undergoing such a large project?
To be very honest with you, you'll find your front end users, whether you're a nurse, a physical therapist, even a physician, there's always that what's in it for me. And we've learned through our different styles of messaging, depending on who we're messaging to really give them the what's in it for me. And we've used that very successfully in many of our previous projects. And this one, we certainly use in this project as well. Absolutely.
All right, well, let's move on to your best practice number 2, which was tailoring the message to the stakeholders. So I think that's a perfect segue. Can you walk us through how you went about gaining buy-in from each of the necessary areas?
So during the Go Live, we really worked with the program director of informatics at the site to determine where they were most accepting of the new solution. And so typically our nursing units were very, very accepting. They were very excited about the opportunity for additional education earlier on, and particularly the videos for their patients. We also found that our resistors were the ones we wanted to sit down with, and our ancillary therapies were one of those where we were told that they already had a very standard packet of discharge information that they gave their patients. And so we showed them the step-by-step instructions, which was really a big win for those. The step-by-step instructions don't have any text on them. They are simply very simple pictures for a patient to walk them through things such as using a nebulizer or walking through an exercise post-surgery. So once they were able to see that, they saw additional value in those kind of specific discharge instructions, and that's when they started to get excited about the FHIR implementation and started wanting to use the application and play with it and see what else was available to them.
Okay, great. Let's move on to best practice number 3, which was you made a very strategic decision to sunset your legacy patient education system. Can you tell us more about your decision to do that and how important that was for the implementation and the success of the Go Live?
So as with any initiative within IT, sometimes it touches more than just one application. And can you advance the slide for us as well? It touches more than just one application, and we found that engagement with all of our application teams would be very beneficial. At the same time, going to operations and having the conversation that and we'll call it clinical references, our previous workflow that we had not only in our ambulatory clinics, but in our other areas within the hospital system, they were all utilizing. And so we needed to have a strategic plan on how we would sunset that workflow. We didn't want to have two workflows available for clinicians. We knew that that would impact adoption, and then down the road it could lead to some confusion as we onboard new employees, and there's two ways to do something. One way is not as desirable as the other. So we talked with our operational sponsors and our informaticists across our system, and we determined when we would sunset that legacy process. Of course, it was still one of our CRAME StayWell functionalities, but we gave our clinicians 3 weeks and continued to support their adoption of the new application. And we were successful in turning that off. We did get a couple of tickets. We did hear a little bit of something, but overall, the transition has been fairly smooth.
Okay, thank you. I believe the next best practice was your significant investment in training, during training early, during the go live, and throughout the whole process. Can you discuss some of the strategies and tactics your teams used to make sure everyone was trained and the adoption was as high as possible?
Of course. I will say that training is really a big debate here in our organization. You know, we have adult learners, and there's truly no one tool that works fabulously for everyone. So IT really got together with our System Education Council. We pulled in our informaticists, and we really worked to determine what would be the best solution overall. Because as we stated just a few minutes earlier, not only were we targeting just your RNs in the organization, but we were targeting some of the ancillary staff as well. We had some low engagement from our ancillary teams, not feeling that they owned patient education. With this nice new initiative, it gave us an opportunity to really drive that it shouldn't be solely owned by the RN, but we need participation not only from our pharmacists, but also from our other ancillary, from nutritionalists, respiratory therapists, PT, and the list can go on and on. So with that, the decision was made to use our learning management system. So our LMS system is where we landed to do the education from across the system. That allowed our clinical staff to sign in to the system, participate in the LMS lesson, and they had some working knowledge prior to the go live. We do monitor the percentage of individuals that have been compliant with taking the lesson. So we do a targeted communication out to leadership to let them know where their percentage is for completion before our go live. It's always important to use your key stakeholders. So we used our CNOs across the campus to communicate to their staff. A little healthy competition between the hospitals never hurts. To see those compliance rates go up on their LMS. And we did encourage even post-go live for some individuals that may have come off a leave of absence. We leave the LMS available so the users can go back in and review if they need to. And the most important part is really being visible during the go live. I think it's important for them to understand, yes, you saw the LMS, but we're here to support. You can place a help desk ticket, you can reach out to your informaticist, talk to your super users, but getting them to really quickly set up some of their favorites was really a big win, I think. We have discharge nurses in some of our very busy, large med-surg areas, and they had favorites probably created in the first hour. And we were very proud to see them adopt that type of practice. Lastly, I wanted to point out a little bit about, oh, sorry.
Go ahead.
I wanted to point out a bit about keeping the resources coming. We do have a communications division that we work with on a routine basis here out of IT that pushes out to targeted clinicians certain types of communication. So it's very important whether you have, an email distribution or a website that you direct your your clinical staff to, where they can really easily find resources and any type of updates, testimonials. We're working on right now sending out a nice communication about this particular project. Our CIO is being interviewed, and he'll be sending out a nice newsletter, in his newsletter, a nice plug for this project. So keeping it in front as a reminder and having strategic communication around it is key.
Absolutely. And I think you relayed to me that you had some of the ancillary departments like physical therapy were surprisingly some of your most vocal champions during the process.
You're exactly right. I rounded, and there was a physical therapist that literally stopped us in the hall and hugged us and wanted to share how excited he was and how much it meant to him. And he said in the beginning he wasn't truly a believer, but he wanted to be a super user. And he talked to the informaticists on his campus, and he was really energized. So it's nice to be on the front lines and hear that positive feedback.
Okay, great. And I think you have a very interesting and exciting strategy as well to track the success of the new patient education application throughout the organization. Can you relay to the audience your plans there to show improvement in patient SAT, outcomes, and the like?
Yeah, so prior to the beginning of the project, we had determined key performance indicators that our organizational leadership had determined they wanted to see. And so, as you said, it was really around how we take and put Epic data with our patient satisfaction data in our data warehouse, and then can look at success rates quarterly by diagnosis, by readmission, and see if those readmissions have gone down, if that patient satisfaction has gone up, related to the patient education that we're being able to give.
That's very exciting. We're excited to see the results of that.
As are we.
Okay. Any last notes before we move on to Q&A as far as sharing best practices or insights during the implementation?
I think we pretty well poured out all of our wisdom that we have.
Okay. Well, I know there's a number of questions that came in through the chat here, and I'll start off by throwing a couple to you. One question came from the audience and asked if you were using Crane's legacy platform prior to moving forward with Crane's on FHIR.
So we were using Crane's legacy platform, and we continue to use the legacy platform in our ED. And so currently, we don't have the API in place that will allow us to suggest content from FHIR for impressions. And so we're looking at that being live November of this year.
And I believe that there is an update within Epic. April, Luna, if you're on the line to share an update on that piece.
Yes, so that clinical impression will be available in the February 2019 version of Epic.
Correct,
Fantastic.
and we'll be implementing that for our end users in November of 2019.
Fantastic. Well, I know Epic really prioritized that once we brought that to their attention as a group, and so that was great to see that that release is coming. Another question was, do you at Houston Methodist use MyChart at bedside?
So we do not currently use MyChart Bedside. We have it enabled, and so if a user were to come in and they had their own smartphone, then they could use MyChart Bedside on their smartphone through their own device. We don't have a strategy at Houston Methodist to provide devices to our patients. However, with the updates in Epic that is combining MyChart with MyChart Bedside, we are looking at rolling out a new pilot so that we can look at the effectiveness of MyChart Bedside.
Okay, great. A couple of other questions have come in. Can you kind of walk us through what the end users see as it relates to the integration with Epic with Crames on Fire, and how is that different from the previous workflow?
So I guess without seeing the visualization within the app, I will say that it takes information in Epic, for example, their problem list that the physician has listed, as well as the medications that the patient has prescribed for them while in the hospital, and any procedures as well that have been ordered. So those are set up in a nice orderly tab fashion, so really like file folder tabs across the screen, and the clinician can select under that tab and kind of do their cart shopping, if you will, from there. So it's very, very easy to use, very straightforward, and we've literally seen clinicians do it and perform the task without taking our LMS, but we do recommend that they see the LMS because it gives them some nice tips and tricks.
Great. And now with Crames on Fire being a brand new application and user interface, how is that represented? Is that represented within the frame of your EMR, or does it launch a separate screen and require a separate login?
It doesn't require a separate login, and for the clinician, it's seamless. It's literally as if it's within Epic. We do some slick technical things, or your guys do, to make that happen.
Okay, great. Let's see. Can you discuss, I don't know if we'll be able to show, how Crames on Fire reports help you improve patient education?
So really, it's the tools that are available to the clinician. Engagement, we've always heard the old adage that discharge teaching starts at admission. And what we found historically, that nursing had gotten into the cycle, and I will say nursing because it wasn't until we started this initiative and this project that we really engaged our ancillary folks. But previously, nursing had gotten into the cycle of giving instructions to our patients literally at discharge. And, in the worst case scenario, you see the patient in the wheelchair, rolling towards the valet ramp or, out to their car, and the nurse is running behind them trying to give them their education material printed out in paper content. This particular approach really changes a lot of that. We hope for, that engagement of the patient while in the hospital and engagement post-discharge. We found that the value of paper, while is important for certain learners, video content is far superior. So allowing them to watch the video while in the hospital is a workflow that they can do, as well as post-discharge, watching it through their portal.
Okay, excellent. And can you speak a little bit to the second release of Crames on Fire and your vision for how that will work with patient engagement, with the ability to get more advanced analytics on whether a patient has viewed the content or not?
I'm thinking that maybe Chris Klickner or one of those guys could probably answer that better than we could. Graciously, I will yield to Chris.
Chris or April, do you want to address the patient portal integration in the second version of Crames on Fire regarding the ability to assess comprehension?
Yeah, I can cover that. I just had to get off mute there for a second. Thanks, Joe. So basically right now when the patient education is written back to Epic, it's written back to the AVS. So that's currently how the patient views the education in MyChart is through the AVS. Going forward, when we roll out our MyChart application, which will be complementary to the Crames on Fire app that's within the EMR, that education will be sent directly to the MyChart app, allowing us to be able to report back through a dashboard within Crames on FHIR whether or not that patient education has been accessed by the patient and or whether they have watched a video or not. So that information, once it is sent back to the dashboard, our clients, such as Houston Methodist, will be able to grab that information if they are choosing to do so and put that in their data warehouse and then be able to compare that back against the patient SAT scores and some of the pre-admission, or excuse me, the readmission rates and some of those other things that they have as far as metrics go. And just to kind of touch on one of the previous questions, Crames on FHIR really hasn't been live long enough at Houston Methodist to be able to start grabbing any of that data to compare. At least I think that's what you had explained to us, Suzanne and Jenny.
Correct.
Yeah, that's correct. We like to look at our patient SAT scores over a quarterly basis, and we went live 5 days before our quarter closed. So we're really wanting to have a solid quarter and then begin to look at some analytics there.
Joe, did we lose you?
Okay, I'm back. Sorry. There was a couple questions that came up here regarding Cerner. Obviously, there's some folks on the line that use the Cerner EMR system, and fundamentally, the design and the application of Crames on FHIR is very similar in that it's within the discharge workflow. It's native within the Cerner application, and we have the same integration into their Healthy Life portal to do the same advanced analytics and viewing when that second version comes out. Another question here, Suzanne and Jennifer, that came regarding videos again. Have you made any of your video content available on the IP floors for patients to view while in-house?
So using that same bring your own device strategy, the nurses have the ability to print a QRC code. So particularly if I were an inpatient, I could use my smartphone and scan that QRC code and view those videos real time. Now, one of the things Suzanne and I have talked about is we still have some iPads left over from another pilot. We are looking at piloting those at 2 of our facilities on an inpatient floor so that the nurses would then have a device that they could walk into a patient room and scan, the QRC code and play that education real time. We think for inpatient that would be important. We also think particularly pre-procedures. So for that patient that's admitted in the ED, goes upstairs and is going to have a cath tomorrow, being able to show them the video education about a cardiac cath, we want to see how well that works, and we can see targeting those patients. So it is on our future roadmap, and we would like to accomplish that yet in 2019.
Okay, great. Another question here was from project planning to go live. How much time did it take? And are there more languages available in Crames on FHIR?
So our kickoff was last May, and we started our project, and our go live for the system was March 25th. At Houston Methodist, we do like to do a pilot, so we did start our pilot in January of this year, and so it truly was not quite a year for the full project.
And
okay,
Chris and April, for the audience, could you go over kind of the implementation for Houston Methodist versus some of the more recent clients that we've implemented?
Yeah, let me address first.
Okay, go ahead.
Let me address first here. Houston Methodist was one of the early adopters in the implementation. So what we've seen is between 3 to 5 months from the time we kick off to the time we go live within your EMR. So that's the more standard time frame. Again, Houston Methodist was a gracious strategic partner and agreed to be an early adopter. So there were some things that we worked out between Houston Methodist and Epic that we are now seeing repeatably, and we are able to prepare for and move much quicker throughout that implementation. Chris, was there anything you wanted to expand on that?
Nope, you hit the nail on the head, Joe. Thanks.
Okay. Okay, there was some questions relating to custom content and whether within Crames on FHIR you can customize content at the enterprise-wide level or at the personal level. How are you addressing custom content today?
So currently, we do not have custom content incorporated into our options for our patients. There will probably be some work done in the near future around that. There is a desire for standing up some type of governance oversight for that. So we have not actually gone into the custom content realm currently. Now, within the actual application itself, the RN or the clinical staff do have the ability to go in and do edits to a document that they want to print out for the patient. They can personalize it, make it more specific to the patient. However, that is not saved and continued. Think of it in terms of personalization, patient by patient. So they don't have the ability to save it for the next patient.
Great, and just for the rest of the audience, there is the ability with the custom content builder to create custom content. And really the strategy relating to custom content, many organizations really feel like you want to rely on the standard content that comes within the very comprehensive library that Crames provides. But there are needs, of course, to create custom content. Custom Content Builder does allow you to do that within the admin tools of Crames on FHIR and publish that through the audience, through all of the end users. And what Jennifer and Suzanne were just speaking to was the ability to do inline editing. So for any clinician that wants to customize a message or content at that point of care for that specific patient one time, that is available within Crames on FHIR as well. I think we have a couple more questions, and then we'll wrap up. One of the questions that came over was, did the workflow improve for the clinicians and the end users with the Crames on FHIR deployment?
I would say emphatically yes. Not only from an IT perspective, because I would say we're a bit biased. We like new, shiny applications. But when you think of your lowest techie person at the bedside, I would say overwhelmingly yes. The engagement that we received and the feedback from the clinical staff was very positive. They particularly highlighted the suggested content. They are no longer hunting and gathering for information to provide to their patients. It is suggested for them, and it's available to them in a very nice, orderly fashion. I just have to go back again to the example of the medications and that first-time dosing. It's a big focus in many of our med-surg areas as physicians are putting patients on new medications, and that gives a nurse a tool right there in the moment as they're getting their first dose of medication. And then we hope to see that positively reflected in our HCAP scores once we have full engagement and our staff readily using that tool we have set up via this nice application. Okay, well, thank you for that answer. I think we're at the point where we're going to wrap up today's webinar. We have
a number of more detailed questions that came through the line that are related to external EMRs. So we're going to have representatives from StayWell follow up with you after the call. I would like to wrap today's session by thanking Suzanne and Jennifer for dedicating their time and energy to bring this valuable content to the rest of the StayWell community of customers. As you can see, Houston Methodist realized great value to their clinicians, IT staffs, and patients by deploying Crames on FHIR. I thank everyone who participated, and for those registered attendees, again, please be on the lookout for follow-up communication from your StayWell representative. Thanks, Suzanne and Jennifer, again. Thanks, everybody. Have a wonderful afternoon.